everybody, Dr. Alexis here. In this episode of Renatrition's Truth Series, we are going to talk about constipation. And I know it's not something that everybody likes to talk about, but more and more, a lot of our clients, dancers or non-dancers, are really revealing that constipation is holding back a lot of what's going on with them, or it's an underlying factor of what's going on. So I'm going to take this time and just talk to you a little bit about what constipation is, a little bit maybe about what it might not be, and yeah, just share what we've learned, share what we know, and hopefully help you out. So here it goes. The saying goes at our clinic that constipation is a spectrum, meaning that there's different factors and different things that go into being constipated. A lot of people have the idea that as long as I'm taking a poop every day, I'm not constipated. That's not exactly true. You may not be completely blocked up, so you might not be on like the higher end of the constipation spectrum, but you could still have some issues and some symptoms of constipation. So let's just talk about a couple of things that we consider when we're talking about or trying to determine if somebody's constipated. One, we'll just come out the gate with the worst one. One is smell. Like, your poop should relatively be smelly. Yeah. The toxins that are stirring up in our bodies that need to come out smell toxic. So if we're having a bowel movement that isn't quite smelly, it's probably not as toxic, which means the toxins are probably still inside you. Not a great place for those things to hang out. So a lot of times I ask my clients, like, are you pooping? Does it smell? The other thing, effort goes into constipation. There should not be a whole lot of like grunting, pushing, a huge amount of effort when you're in the bathroom. For the most part, it should just kind of effortlessly go. There might be a little bit of pushing involved, but there shouldn't be any grunting or bearing down, or you shouldn't feel like you're, blocked, or it just can't come out and you need like extra time to like push really hard to get it out. That's a symptom, or that is a factor or a part of being constipated. If it eventually comes out, that does not mean that you are not constipated. You still are. Next factor is consistency. We do, for most people to have a healthy, happy intestinal tract and bowel environment, most of us need to be going every day. There are some places or some sources that say like every other day is okay. We don't really like that. We don't even want to start going down the road of keeping more toxicity and more, waste that needs to come out. Keeping it in the body any longer than it needs to be is just, in our opinion, not the best idea. So we really encourage our clients to work towards, setting a goal of being able to easily go on a daily basis. So again, constipation is a spectrum. Factors include smell, how much effort you're putting into it, and how consistently you're going. Next topic about constipation in general. You can be constipated with new poop, or you can have some constipation issues relative to old poop. I know, I didn't really think about this until this is like a very recent revelation that I've been working with my clients on. Old poop and new poop. So new poop is kind of like the stuff that you eat, like you ate today, or you ate like yesterday. That's just newly in your intestinal tract that is, hopefully coming out. Old poop, when we were sick, when we weren't eating as healthy, when we weren't exercising as much, and our intestinal tract was not working at its best or living its best life. Old poop, because the inside of the intestinal tract, you've probably seen pictures, it's like ribbed or ridged. Old poop can kind of settle in some of those ridges. And if we're not living our best life at that point, or we weren't at that point in our lives, then it may not have made its way out. Old poop can kind of get stuck to our intestinal walls and almost kind of like harden and almost kind of become a part of the intestinal wall. And until it's broken down or flushed out, it can break down the integrity of the gut lining, because at that point it's just a consistent toxin that's sitting in there. It can eat away at your gut lining. It can physically hold up space in your intestinal tract, which a lot of people on the flip side come out with having like diarrhea or a different consistency of their new poop. Like your new poop can kind of slide past your old poop and still come out, but it comes out with a weird consistency. So having an appreciation between new poop and old poop, or just an awareness that the two kind of exist, kind of clue you into if something's not quite going right. Make sure that you're letting somebody know so that they can help you. Third thing, I got 5 tips today about constipation. Third tip, the consequences. If you're blowing off, you're going every 2 days, every 2 to 3 days, you got to push a little bit, but it's not too bad. You're kind of you're just kind of letting it go. And I'm trying to speak sensitively because I'm not here to really blame. A lot of times you're just not necessarily aware that these are problems. But somebody's living their life where, like I said, they're going like every other day or every 2 or every 3 days. And they push a little, every once in a while, it's hard for them to get their bowels out. But other than that, it's kind of okay. Consequences of that. Number 1, decreased absorption. If you've got old poop stuck in your intestinal tract, if you've got new poop that's getting stuck that takes a little bit longer to get out, that is less surface area of the inside of your intestinal tract. That is less surface area for nutrients to be absorbed and get into the bloodstream so that it can go to where it needs to help you live your best life. So that's a consequence of not taking care of constipation. Number 2, leaky gut. So in a very short nutshell, because I could talk about leaky gut all day long. Basically, let's take the example of old poop. Remember we said it gets stuck in there, it kind of sticks to the intestinal wall, and since it's toxic, it starts to break down the integrity of the intestinal lining. And I actually describe the intestinal lining like paper towels, layer of paper towels. So if it starts putting little rips in the paper towel because it's heavy, it's acidic, it's toxic, it disintegrates some of those layers of the paper towel, or it's so heavy it kind of creates a little hole or a little punch through, things can leak in or leak through those little holes and those little areas of decreased integrity and get into your bloodstream, things that shouldn't necessarily be getting in there, like bacteria and things like that. They can leak and get into your general abdominal cavity just a little bit and cause symptoms. So consequence of not taking care of constipation early on, decreased absorption, leaky gut. And when that area is not feeling good, especially for you dancers and performers, if that area is not feeling good, then those core muscles are not going to want to lock and load so that you can balance, so that your hips and legs can be flexible. Your hips and legs are going to tighten down because you're not getting good stability over your core because your core doesn't feel good because you're constipated. So decreased core activation and decreased performance can be a consequence, again, of being constipated. So again, make sure you're taking care of that. Point number 4, a lot of people ask questions about probiotics, especially in relation to constipation, things like that. Should they be on probiotics? And a lot of people have questions about prebiotics. Some people don't even know what prebiotics are. Some people don't know if they should be taking a prebiotic or a probiotic, and all these things about the words. So this is how we very generally break down what a prebiotic is and what a probiotic is, okay? A probiotic, in a general sense, is like your good gut bacteria. We have good bacteria in both our small and our large intestinal linings that help to break down food, help to optimize nutrient absorption so that our body gets what it needs to be able to function and you live your best life. That probiotic, those bacteria, should be naturally occurring, should be at a very good and normal level for healthy living. So technically, if we're operating, that's the word, if we're operating optimally, if we're functioning, or if our digestive system is functioning optimally, we should have all the probiotic that we need already in our gut. So we shouldn't necessarily need an external probiotic. I hope that makes sense. Our need to take an external one might be needed In a temporary sense, if there's a virus or an illness or some other reason that's decreasing the availability or decreasing the level of good gut bacteria that we have, and we need to build it up. But when we are talking to our clients, we try to make sure that they understand that a daily regular probiotic, for the most part, should not necessarily have to be an everyday occurrence. It may be needed to get our gut back up and rolling in normal function, but not necessarily like an everyday like supplement per se. Prebiotics. What are prebiotics? Prebiotics are basically the food for probiotics. Basically. Prebiotics are like your fibers, your dietary fibers, your metamucils and things like that. That actually a fiber is more of like a complex carb, which means it's a complex sugar. Bacteria feeds off of sugars. So prebiotics are the food that our probiotics need to grow and live. Again, if we've got a healthy level of probiotics, if we've got a healthy level of good bacteria already in our gut, then the need for an external extra food for probiotics, an extra prebiotic, may not always be necessary. So that's the basic difference between a probiotic, prebiotic. So, solutions. What solutions can you look for, or what solutions can we help you with in terms of reducing your constipation? One, water, 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 water. Drink some water. You may have actually heard of structured water. Structured water just has a good electrolyte balance of healthy minerals to further aid water absorption into the body and further aid all of our body's processes. The quickest and easiest way to get some structured water into your body is a sprinkle of sea salt and a squeeze of a lemon or a lime in all the water that you drink. That is the easiest way to kind of get it in. You can get fancy later down the road if you want, but if you want it to start today and wanted to get some good structured water in your diet, sprinkle of sea salt, not the cheap table stuff. Sea salt, Himalayan pink salt is a good second choice as well. A splash of lemon juice, a splash of lime juice. We recommend fresh lemon or lime, usually the bottled. If you look on the label, it has like some type of preservative in it. So we want to try to avoid that. But just squeeze a lime, squeeze a lemon. You can even drop the rind in the water and, let it stay there. That's totally fine. Number two, not necessarily in extreme cases, I take that back. In moderate cases, if you haven't gone in like a week or something like that and you're real plugged up, a vitamin C flush may be recommended. Sometimes we recommend that to clients, not necessarily something that we would recommend to someone we haven't seen, but I just wanted to present it as an option so that you are aware that it exists. You may have heard in general kind of regular like media that too much vitamin C in your system causes diarrhea. Well, yeah. So we kind of use that a little bit to our advantage. I recommend like a sodium-based or a sodium buffered vitamin C because it's a little bit easier on your intestinal tract. But basically you use that vitamin C to break up mostly old poop is what we're going after when we need a vitamin C flush. Taking that powder, mixing it in water, and taking that powder helps to break up our old poop and flush it out of the system. So it's usually a pattern of taking some of the vitamin C, waiting a few minutes, going to the bathroom, and letting stuff just keep coming out and coming out and coming out. What else can you do to help with constipation? Abdominal massage, actually. If you get like lower into like near your intestines, especially your small intestines, which are pretty much in the center of your abdomen area. If you get in there and just kind of massage a little bit, sometimes that can help get things moving as well. So that's another option that we recommend to our clients. And then identifying your factors. So high fats, high sugars, not enough water, not enough movement or exercise. Those things contribute or kind of lend itself to decreasing digestive system function, so it can increase your risk of getting constipated. Or looking at those factors on the spectrum. Are you pushing really hard? Are you not consistent with going to the bathroom? Is it not super smelly or not smelly at all? There might be some opportunities to really improve your gut health from that perspective as well. So again, I hope those solutions kind of clue you into some things that you can kind of do to help with your constipation. You always know that you can message us on any of our social media channels, email us at info@renatrition.com if you have any other questions, and That's all we got to say about poop and constipation. Hope you guys enjoyed it and got something out of it. Catch us on our next episode.